today's World Insight, an international panel on climate change with the Chinese Minister of Ecology and Environment, meaningful insights on why climate goals like carbon neutrality matter, and a clarion call for international cooperation from words to deeds.
That number 10 ultimately says to me that as a global community, we failed to control the virus.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. This year's Davos Agenda aims to tackle some of humanity's biggest challenges, climate change and the pandemic. On Wednesday, the Chinese Minister of Ecology and Environment, Huang Runqiu, and the American Special Presidential Envoy for Climate, John Kerry, are both participating in the panel entitled Mobilizing Action on Climate Change. But due to time difference, they're attending two different sessions. Let's take a listen to what the Chinese Environmental Minister Huang Runqiu said during his session.
巴黎协定进入实施阶段，为此我提出3点建议。
The Paris Agreement is in the implementation stage. For this reason, I make 3 suggestions. First, consensus on cooperation. All parties should adhere to the United Nations Framework Convention on Climate Change, the goals and objectives set by the Paris Agreement. Developed countries should effectively bridge the gap between actions and commitments before 2020. Climate change and economy, poverty reduction, health, security, and other fields, issues are deeply intertwined. Countries, especially developing countries, are facing the urgent need to achieve climate goals under the framework of sustainable development. Developed countries should take the lead in action. The third is to strengthen mutual learning, and all parties must reach consensus on the basis of mutual benefit and win-win results. China is willing to work with all parties to promote this year's response to climate change. The conference will achieve positive results and share a bright future of green, low carbon, and sustainable development.
探索形成经济和技术可行的政策路径样板。
That's Chinese Minister Huang Runqiu on climate change issues. In this panel, which I had the honor to host, other speakers also give their thoughts on how can we accelerate efforts to avoid tipping over the point of no return on climate change. Here's an excerpt of that. Earlier, the Chinese side already outlined their specific agenda, action, and plan. Now, here's the term for Europe and also for your country, Spain.
The first of them, thinking in terms of one community. So it is our own task being responsible of a government, company, or local community. I think that this is very important. And the other issue is how far we can reach linking values such as prosperity, inclusiveness, opportunities, cooperation with climate action. And this is what Europe tries to do when thinking about a concrete set of policies and regulation to be the first continent to become carbon neutral.
Mr. Momentale, why sustainable development and also fight against climate change so important now for global companies?
I think many people don't realize that the companies operate in very different systems all over the world, different cultures, and we always talk about shareholder capitalism, but that's really a US-centric thinking, because in the US there's a law which says that the board of directors has to act in the benefit of the shareholders. Very few people know that in Europe that's not the case. Many European countries, for example Switzerland, the law is actually that the board of directors has to act for the company, in the interest of the company. So it's a multi-stakeholder concept. But of course, Europe has been heavily influenced by the US, and so there's an overlay here. But here, having friends from China and Japan, two societies I visit a lot, obviously, they have a very different approach to that. There's more ancient philosophy behind it. There's the harmonious society concept in China, for example. And it is obvious to me that my clients who are in China and Japan, for example, when they take decisions, it's always multi-stakeholder. It's always thinking about the consequences the decisions will have on the overall society, on the employees, etc.
Ms. Koike, I understand that your metropolitan government has been working very hard on a plan and action about green recovery toward a decarbonization. Tell us more about the details, particularly from a locality's perspective, please.
The Tokyo metropolitan government is advancing studies for the creation of a green finance market, and we hold a preparatory meeting with experts on February 3rd, next week. So by establishing itself as a leader in the world's green finance market, Tokyo will make sure that financial flows are redirected to ESG investing and invite investment into the future from both within and outside Japan, and of course from Switzerland.
Mr. Shin, what are some of the most important agenda for you? How to keep the balance some of the earlier speakers already talked about?
I propose three-step recommendation that I have for all CEOs and industry leaders around the world to make this happen, and that is commit, operationalize, and engage. First, we should commit ourselves to the goal and declare that this is your personal priority as a CEO, otherwise it's not going to happen. And then operationalize, in other words, set specific milestone and develop actionable plans to get there. Without clearly defined reduction goals and strategy and actions, the slogan alone can be quite hollow in a hurry. And then third, engage. We need to collaborate with many other stakeholders, such as public sectors, society at large, to tackle this issue together as a team.
That's an excerpt from an earlier discussion at Davos Agenda, which I hosted on climate change. In our future programs, we're going to bring you more details of this conversation. And you're watching World Insight with me, Tian Wei. Coming up in the program, a clarion call for international cooperation from words to deeds. Next on pandemic control. Unheard of challenges. Uncertainties, unprecedented agenda-setting efforts, not in the snow and ice world of Davos, but still aims to rally the minds and hearts toward cooperation and bridge building. Join me in sessions I host on the Davos Agenda and in in-depth interviews with some of the world's most respected minds. From all corners of the world, drawing up the Davos Agenda. The world is changing fast, taking all our lives with it. But we can change it too, by seeking answers to problems through discussions and debates. On World Insight, I ask direct questions to real people in the know, seek genuine answers, but respect diverse perspectives. Our live global debates tackle the most critical issues head-on. World Insight with Tian Wei. Go beyond the headline. This is World Insight. Our program is devoted to Davos Agenda for today. The global tally of confirmed COVID-19 cases has surpassed the 100 million mark, according to Johns Hopkins University. At this year's virtual Davos Summit, Chinese President Xi Jinping opened his speech with a topic on pandemic, calling its health and economic impact the crisis rarely seen in human history. President Xi stressed that containing the coronavirus is the most pressing task for the international community and pledged that China will continue to play its part in contribution. He said a stronger global response is needed to defeat COVID-19, and it's especially important to scale up cooperation on research and development, production and distribution of vaccines and make them a global public good, accessible and affordable to all countries and people from different corners. So far, China has aided over 150 countries and 13 international organizations, sending 36 medical expert teams to countries in need. So how could the call of action bring more countries to work together on the pandemic? What is the latest with the prevention and control? And what is the latest with the vaccination? Let's loop in our panelists from different parts of the world. For more on global cooperation containing COVID-19, joining us in Providence, the U.S., Dr. Megan Rani, emergency physician from Lifespan Brown University. In Seoul, we have Dr. Kim Kang-tan, the internist at Ms. Medi Women's Hospital in Beijing, Dr. Ding Sheng, Dean of the School of Pharmaceutical Sciences at Tsinghua University. Ladies and gentlemen, welcome to the program. More than 100 million cases already worldwide. What does that mean, Dr. Rani?
I mean, the number is almost unfathomable, isn't it? It's difficult to imagine how many people have been infected and how many have lost their lives. That number, Tian, ultimately says to me that as a global community, we failed to control the virus over the last year.
What do you mean when you say we failed? Does it mean we have to wait for the passive herd immunity?
I don't think that it means that. There are certainly some areas across the globe that have managed to either slow or stop transmission of the virus through those very basic public health measures that we've been talking about now for so many months. Things like masking, like physical distancing, things like not gathering indoors except for when necessary, and certainly always wearing a mask when you're there. Things like testing. When we put those things in place, we don't see the spread of the virus to the same degree that we do without them. Additionally, now we've got vaccines, right? And we've seen already in Israel, as they've crossed that 25% of their population that's vaccinated, they've seen a dramatic drop in new infections among the groups of their population who've received the vaccine. So it's not about waiting for the virus to just take its course, but it's about us taking the actions that are needed to slow the virus's spread.
I see. Dr. Tan, do you agree with that?
You know, this pandemic that's now affected 100 million people and caused more than 2 million deaths started with most likely just one positive case. And that's how it is in every country, in every region. All it takes is one. And it's that concept that's, I think, very difficult for people to wrap their minds around, that it can start with one and go to 100 million. That it could be asymptomatic, but also life-threatening, that it could affect not just urban centers, but also rural communities. Unless every person understands this and then acts accordingly, unfortunately, this may just be the first round of the pandemic. And some scientists have talked about a second round of this pandemic in 2021. We absolutely cannot let that happen.
Dr. Dean, the picture is not beautiful at all with 100 million numbers already worldwide. What does it say to you about our capability prevention control?
Clearly, we see the outbreak containment strategy actually is quite different in different countries. But on the positive side, actually, we're seeing the vaccine, several different vaccines getting into the late stage trials and also getting approved. And also, as Megan said, it's actually in certain countries, actually, a significant population actually already get vaccinated and also seeing a pretty dramatic effect. And also, actually, we're learning more about the pandemic situation. As well as actually the vaccine and also therapeutics are being further advanced, we're also seeing hopes for controlling the pandemic situation.
Right. Since you all mentioned about the vaccine, let's talk about the vaccine briefly. Now, we have several options worldwide. There might be some friendly competition among them, which is wonderful because that makes all those who are manufacturing or research about them to improve. But would the vaccine really be able to help the overall global population to avoid what Dr. Tan just talked about, the worst scenario, the second round of COVID-19 within the year? As we know, the numbers that are getting the vaccine could still be limited. Dr. Rani.
Honestly, that's the $1 million question.
It's probably a $1 trillion question in that regard. Yeah.
The first thing that it depends on, of course, is whether or not we can ramp up production successfully. In the United States, we have emergency use authorizations for 2 vaccines. There are obviously other vaccines that have already been approved in the UK, in Russia, and in China that we're not using in the United States. All of those would require production to be ramped up. And then there are a bunch of vaccines out there that are in phase 2 or phase 3 trials. If those also can get approved and production can be ramped up, then there is hope. But chance of us truly vaccinating everyone across the globe before the end of 2021 is realistically quite low. I think our chance of even getting all of China and all of the United States vaccinated by the end of 2021 is going to be a stretch.
Dr. Dean, what's your judgment now? Proactive herd immunity is what we want through vaccine, and yet the number could be limited, and we do not know how much % of the population have to be vaccinated in order to reach the so-called proactive herd immunity, but some suggest at least more than 70%. What's your take?
Yes, actually, it is estimated perhaps 60 to 70% vaccination of the whole population could actually be really meaningful to really contain the viral outbreak. But already, actually, for example, in Israel, roughly now nearly 50% population actually is already vaccinated, and clearly what the world has seen is actually a pretty dramatic actually drop in terms of new infections. So clearly, in certain countries, actually getting increased percentage of population vaccinated actually would actually lead to really meaningful viral sort of a containment for sure.
Dr. Tan, what is the scenario that we're seeing right now regarding vaccine and herd immunity, proactive, I mean?
We have a fairly good sense of where we need to be in terms of herd immunity, but the COVAX facility from the get-go, their goal was to have 20% of the world's population vaccinated by the end of 2021.
Right.
And that was seen as an ambitious goal. We think 23, maybe 2024, we might be able to achieve global herd immunity. So I think it's important for people to have sort of a realistic, anticipation. This is something that needs to be prolonged, probably for at least 2-3 years. And I think it's especially interesting because we know that the variants of concern, so the mutant strains, are also in Israel, and there's a big question about whether the new mutants will be covered by the vaccines that are currently approved. And so I think all eyes should be on Israel to see if they are able to achieve herd immunity despite having the new mutations in their country.
Right.
That, of course, is going to be another hot issue that needs to be dealt with.
When we look at the variant and the mutations Dr. Tan mentioned, Dr. Rani, a lot of it is only about discovering them without really know what to do with them, without really know the impact of it concretely, without know the scale it might spread. Tell me more about, this struggle. Apparently, at least I see it from the outside.
Oh, you're absolutely right. As physicians and as public health professionals, we practice based off of evidence. We are used to changing what we do because we have good quality trials that tell us this is the best thing for a patient or for a population.
Right.
The trouble with COVID-19 and with the SARS-CoV-2 virus that causes it is that we don't have time to wait for that best quality evidence. And so we really over and over again have had to make our best guesses about how this virus is transmitted, about how to stop its transmission, about what the most likely candidates for a vaccine are, about what the best treatments might be. A lot of the time we've been right, but sometimes we haven't. And one of the discomforts of that is that, of course, that trial and error process that usually happens in our labs or in our medical journals is now happening out in public. And I think it's discomforting sometimes for people to watch, and it's certainly tough on us. It creates a lot of internal debate within medicine and public health as we try to figure out the best next step to take.
Dr. Ding, also to you, you've been working with your colleagues, with your institute, around the clock for solutions of COVID-19 in terms of research. I even visited some of your labs. You were explaining to me in detail how they're supposed to work. But there are always constant questions, and the mutation and also the latest development of virus making everything much more complicated. Tell me more about that.
There are now actually several variants appeared in certain countries and regions, and they appear to be more transmittable, more harmful. But also, I think actually over the last several months, is actually the global surveillance about actually monitoring new variants appearing is getting better. The preliminary results suggest actually the new variants can be covered to at least to some extent by the existing approved 2 vaccines. So those are very promising, hopeful information. And we also heard, for example, Moderna is actually updating, it's trying to develop the next generation to update their vaccine regimen to really cover the new variants. I think it's a constant race between the scientific community, our biopharma community, to develop the new strategy to counteract the new mutant, new variants. I think in the coming years this will be a continued race, and our scientists are really getting better at this.
Both fascinating and thought-provoking is the different stages that our countries, including the 3 of you where you are from, South Korea, the United States, and China, the different approaches being taken by these countries for their own domestic situation about prevention and control, and now also about vaccination. Dr. Tan, South Korea, during the process of the past year, how would you characterize this ups and downs of prevention control and now the stage of vaccination?
So our policy from the beginning was based on what we call the 3 T's. So testing, transparency in terms of information, and that leading to building of trust in the community. And then treatment and isolation is tied in with that. It worked well, I think, in the beginning. In the beginning, we had a big outbreak, but it was localized. During this last 3rd outbreak, it was spread out in Seoul. And Seoul, the Seoul metropolitan area, has the 6th highest population density in the world. And we had a very, very difficult time containing this last 3rd wave. And we had to shift our testing strategy from just testing people who were suspected of having the disease to opening up testing in the community so that anybody, regardless of whether or not you had symptoms, whether or not you were a contact of a positive case, anybody could get tested in the Seoul metropolitan area anonymously and for free. And I think once we made that shift in our testing policy, that really did help in getting our 3rd wave under control. As you said, it has been a series of ups and downs. One area I think where we could have acted quicker was in protecting our elders in long-term care facilities. Unfortunately, our case fatality ratio has gone up considerably. Right now it's at 1.81%, which is higher than the United States, higher than India, higher than Japan, and much higher than where we were in March of 2020. And I think this has a lot to do with outbreaks that occurred in nursing homes and convalescent hospitals. Our strategy now is to do preemptive and recurrent testing in these facilities, and we've certainly detected many asymptomatic cases through that policy that was implemented starting in the winter of 2020. We actually will be starting our vaccine rollout next month. And we're starting most likely with the AstraZeneca product. And of course, that product does not have the sort of cold chain requirements as the mRNA vaccines. We will be targeting, of course, people who are in the long-term care facilities and healthcare workers. And hopefully we'll be able to build on our national influenza immunization program that has been very successful up until now, to get a good rollout. And of course, we're looking overseas to learn from the mistakes and challenges perhaps of other countries, because we know that uptake of the vaccine is of course crucial. I mean, having a vaccine, someone said, vaccines do not save lives, vaccination does. And so we need to make sure that the vaccinations, the vaccines get into the arms of the people who need them as quickly as possible.
Right. Thank you for sharing with us the South Korean situation. I want to go to you, Dr. Rani, about the United States. Very dramatic, shall I use the word, over the past year. Many factors that are having an impact on your prevention control. How would you characterize this process, and how would you characterize the current stage of vaccination with the goal of so-called 1.5 million a day into the arms of the people?
Yeah, so our control strategy over the last year has really been actuated on a state-by-state basis. There was very little federal level strategy between last January or February and this January. And what we saw as a result was that every state did their own thing. Each state had its own cutoffs for when to close and when to reopen. Every state had different rules around masking. States had different strategies and IT systems for getting tested. And that was where we saw also very different patterns of surges in the virus across the country. You know, the early spring of last year, we saw a huge surge in the Northeast, and we saw it in the Southwest and in the South. California, there was the surge in the early fall across the Midwest and the Rocky Mountains. And then, of course, over the last few months, we've really had this explosion of cases across the entire United States. I will say that our strategy is changing a little. So since our inauguration, our transition of power from former President Trump to President Biden last week, we've already seen our Centers for Disease Control and Prevention start to rework some of those guidelines and provide clearer federal guidelines to states, as well as clearer federal mandates about some preventive behaviors, such as now requiring masks on all federal property and on all interstate transport, which was not the case earlier. So we're seeing some shifting in our kind of national strategy around that. Regarding vaccination, we've been in the same boat, where our federal government funded the development of many of these vaccines through Operation Warp Speed, but didn't really invest either in creating the playbook or in funding the logistics and that last mile delivery of the vaccine into arms. And so that's where reading a lot of news stories about the dramatic lines and the overwhelmed call centers and the very frustrated citizens across the country right now. Again, with the transition of the new administration, they're currently trying to figure out just how many vaccines we even have available, and then trying to retool the system for better distributing these vaccines, which, as Dr. Tan acknowledged, we are at this point in the United States largely dependent on the mRNA vaccines, which do have tremendously specific cold storage requirements, both in transportation and then once they are thawed, in keeping them at a stable temperature for only a limited number of days. So we're struggling with a lot of stuff, but I see hope and change in sight.
Yeah. Dr. Ding, China's case, earlier stage, China, of course, giving the warning to the rest of the world. Later, it become one of those best examples of prevention control if you look at the numbers purely. So, Dr. Ding, tell us more about how would you characterize this process over the past year, prevention control, and now, you know, when it comes to vaccination, where is China?
Yeah, absolutely. I think over the last year, China managed really well in terms of controlling the viral outbreak situation, certainly by sort of doing testing and also contact tracing and all of that in a very methodical, in some cases actually pretty aggressive way. This worked really well so far. and more recently, there perhaps a few more very small surges in certain areas, but those again are controlled quite reasonably well. Certainly in the coming days, vaccination actually with different priorities is really important. I'm pretty hopeful given in China, the community clinic, hospital, and also the overall vaccination programs for other vaccines actually work quite well. And again, learning from last year, this outbreak control management, I'm pretty hopeful actually vaccination across the overall population in China actually can get done actually within perhaps 2021.
We have seen over the cases some examples of the divide between the rural and the urban areas of China regarding the capability for prevention control. How will China move on from here in terms of vaccination?
The China rural-urban divide, I mean, in my view, it's not so much a concern. Certainly, in terms of management control system is slightly different. But again, the China vaccine actually doesn't really require a very stringent like cold chain distribution. And again, at the local level, actually, the clinic can administer those vaccines reasonably well. So I think in the coming months, vaccination program actually can proceed as actually what the government planned
What
in
about
advance.
What about the upcoming Spring Festival, China's Lunar New Year? Just like in the West, the Christmas, it's going to be extremely challenging. Massive population on the move.
I think it's currently advised by various local, authorities or organizations. Actually, unnecessary travels actually would be sort of discouraged. So again, I don't really imagine there will be a very massive traffic during the coming sort of holiday season.
I see.
And again, I have to say, even in the current situation within China, there's really not much infection transmission actually occurring compared to pretty much the rest of the world.
Yes.
Given in that small number, and again, people are really, maintaining their social distancing, wearing masks, all those practice, and also at a higher level, all the contact tracing, testing, all of that actually is still being rigorously practiced.
It's good to know how every country is trying to function under different circumstances. As we know, borders these days are mainly tightly controlled, if not closed, due to COVID-19. So it's really up to various countries to do their own job. But we don't want to forget, ladies and gentlemen, about international cooperation. Both the vaccines and the therapeutic treatment and also prevention and control all needs coordination as well as close international cooperation. We have heard at the ongoing World Economic Forum, Davos Agenda, for example, enormous amount of discussions about that among world leaders and also business leaders too. Tell me, how will that be done besides COVAX, this platform we have? What else do we have? The vaccines distribution, who will have access, affordable accessibility, all these become huge problems. Dr. Rani, the U.S. coming back to WHO and also COVAX, will that be swift and quick actions becoming one member of the community and contributing? I know it's political leaders' issue, but I just want to ask you from a physician's perspective.
Absolutely. So I obviously can't speak on behalf of our administration, but from the communications that I've had, certainly our stating that we're not going to leave the WHO is huge. This virus is a global virus. It is not the problem of any single country. And for us to pull out of the World Health Organization was really just ridiculous in the midst of a global pandemic. So I think it's a critical step. What will happen next is still kind of to be determined. I'm quite hopeful that we'll see excellent cooperation around scientific research into the new strains of the virus, into treatments, into novel versions of vaccines. But that is to be determined based off of both funding, but also, of course, political considerations as well.
So, Dr. Ding, now China has come out of this pandemic relatively, at this moment, better in terms of prevention control. But it's not the rest of the world's problem. It's all of our problem, right? So, Dr. Ding, how do you see the cooperation and collaboration on all these fronts regarding COVID-19? What's China's role?
As we already know, China is part of the COVAX, and certainly China already actually is providing the vaccine actually to some other countries for people to be vaccinated by the vaccines developed and manufactured in China. And also over the last year, we know actually, for example, our institution, our scientists actually are collaborating, have been really collaborating closely with our global partners on basic research, as well as actually vaccine development, neutralizing antibody development for COVID-19. Again, as actually we're seeing new mutation or variants actually occurring, this will be a continued effort. And again, scientists in China will continue to closely work with global collaborators, partners on those different fronts.
Do you see possibility for China-U.S. cooperation in that regard? Dr. Ding, since the new administration coming in, a lot of people are asking that question.
Absolutely. I would say even in 2020, last year, actually, scientists in China actually have been really working with scientists in the U.S. actually on basic research, as well as actually drug development, vaccine development for COVID-19. That collaboration actually has not actually been stopped by any specific policy. Clearly, in this year, we'll see perhaps even increased close partnership and collaboration.
Would that be also your take, Dr. Rani?
You know, it would. We do have a long history of scientific collaboration between our countries, and I would be hopeful that that would continue. I think that we are all stronger, both from a scientific standpoint, but also from a public health standpoint when we work together.
Dr. Tan, about the vaccine, there has been some rather competition among different types of vaccine, even though that is, as we said earlier, friendly because it's going to help populations of different parts of the world. But Dr. Tan, how do you see this competition? How we're going to make the resources work for the maximum impact when we put them together?
Well, I liked your term friendly competition. I think it's
I invented
not competition
in this regard,
yeah,
but I don't know whether it's the best way to describe it. But please go ahead, Dr. Tan.
Right. So it's not competition against each other. I think it's more on the level of information sharing and how can we improve each other's products. A few weeks ago, our KDCA, so our equivalent of the CDC, we held a meeting with Dr. Anthony Fauci of the NIH in the United States regarding the possibility of cooperative research and sharing of mRNA technology. And this is the type of, I think, cooperation that needs to go forward on a global scale. We need to be able to, and this is really the only way that we're going to be able to scale up the production of the vaccine needed to get, billions and billions of doses into the arms of everyone around the world. Unless we take a cooperative approach, we are doomed to failure. So in terms of competition, I think it's more, right now we need to build our portfolio, our vaccine portfolio. As I said, we're going to look, 2022, 2023, 2024, many years ahead, we will need vaccines for COVID-19 going forward, billions of doses. So the more vaccines we have in development, the better. We also have to consider that some of these products may fail, and there might be technical difficulties. There will be technical difficulties, as we go. And so we need, plan B, plan C, plan D going forward.
And not to mention therapeutic treatments. There's a lot of things that we also need to do on that front. Well, today the world had to bear with number 100 million COVID-19 cases. However, listening to you, we do see much more a silver lining of the issue, but also hope, which is even more important in this regard. Thank you so much for all your service over the past year. I've been talking to you constantly over the past 360 days. Thank you, really appreciate it. Dr. Megan Rani, Dr. Alice Kim Kang-tan, and Dr. Ding Sheng, thank you, and be safe yourself. And that's all the time we have for today. If you'd like to see more, try to find us World Insight. That's the name of the program. Or check out our YouTube channel. You can also follow us on Twitter and Facebook. I'm Tian Wei. On behalf of my team, thanks for watching. Bye for now. Be safe wherever you are.